Hello, everyone, and welcome to another episode of Arthritis at Home. Today, we're featuring a special episode. It's October 8th, and it's Arthritis Day on the Hill, where the arthritis community is calling upon the federal government to address urgent gaps in arthritis care. ACE and Arthritis Society Canada are co-leaders and co-chairs of an advocacy and awareness working group that is behind the work that's happening today. And I'm joined by two of the key people who've collaborated with us, and that is Kelly Gorman and Joanne DiNardo, Senior Directors, Public Policy and Government Affairs from the Arthritis Society of Canada. Kelly and Joanne, welcome.
Thank you.
Thanks for having us.
So this coalition or collective of leading arthritis organizations, patient groups, health professionals, and volunteers from across Canada are going to the Hill today to meet with government officials. What exactly is the format for the day? What kind of activities can we be looking forward to, Joanne?
We are so excited to be here, first of all, as a collective voice of 21 organizations, 21 voices strong, representing arthritis across this country. And we're really coming to educate, to partake in discussions, to bring awareness to the devastation that is arthritis. And to come together and solve arthritis and talk to politicians and talk to government officials about how to solve arthritis. And we're starting the day with meetings. We're going to be set up in multiple groups and go forward and have discussions about our key policy recommendations that can impact people with arthritis positively from a quality of life perspective and in terms of giving each patient a voice and hearing stories and hoping for policy change. So we will be having meetings. We'll be attending a question period. In question period, we hope to hear arthritis out loud in the legislature. That would be amazing, and that is expected. So we will be doing that. We will continue those meetings, and we will be sharing all the activities of the day on social media, and are so happy to do so. And we're going to come back. This is not a one-time affair. We will come back to the people that we meet with, and we will report back to them on what we talked about and what we continue to need, and to really just sound the drum on arthritis.
So to give our viewers some background, Kelly, the lobby day has really been almost 2 years in the making, if you will, and that is the community has been working on some foundational documents that it's created over the past couple of years that has led to today in terms of us being able to present in a unified way the story of arthritis, the impact, the burden of arthritis in Canada, and proposed solutions and recommendations. One of these documents is the State of Arthritis in Canada report card. Can you tell us just a little bit about the making of that and some of the key findings from that report?
Sure, thank you. Yeah, that was a really big endeavor for us as an organization. And it was building, we did a report a couple years ago around wait times for joint replacement, hip and knee joint replacement. And again, that was really a collective effort. We worked with people across the ecosystem to develop that report that had really strong recommendations, but it was focused, around joint replacement strategies. And then we really thought as an organization too, we need, to broaden it and look at arthritis as a whole and kind of have like a bit of a baseline of what is happening across Canada, so that then we know, where we're starting, and then help us measure where we want to go and keep track of progress. And so it really truly was a collective collaborative effort. We had many different organizations involved with it. And it took us a long time to put it together. And it was a bit of a challenge. And this is one of the kind of key findings was around the data available, because we were just using publicly available data. And it was a real challenge for us to be able to find data on some things, or also to find things that could be compared across provinces and territories. And so that actually impacted what we chose as our criteria. So for the report card, we looked at we had kind of three bucket areas. We were looking at access to care, arthritis care, wellness, and research and innovation. And so we had different factors in each one that we looked at, and the provinces and territories kind of received a mark out of 100, and then we turned it into a grade. And, what we found is that actually no province or territory is doing very well. It wasn't a surprising result, but now we just kind of have this document that we can use to leverage saying, this is what's happening. And then we can use it to say, this is what we'd like to see happen. And we are going to continue to measure and see what progress is being made across the country in terms of, how arthritis, research and care and treatment. And, the key kind of top findings, as I said, arthritis data is insufficient. Accessing arthritis care is a challenge. We found, again, in terms of medications, depending which province you live, that can impact the access that you have to these medication. And again, we know that saying that it's available on a formulary does not necessarily mean that people are getting these medications. So that's a real challenge. We also, we heard a lot of anecdotal, and again, we weren't able to track this around the wait time to see specialists in terms of rheumatology and how long it's taking to get diagnosis. And going forward, that would be really something that we would like to look at. And so it is a foundational document for us, and we shared it with all the provinces and territories. We also shared it with at the federal level, because we really feel that the federal government has a role to play as well, especially in terms of the research funding, and then again with some of the funding, the bilateral agreements that have been signed with all the provinces and territories. So this is an important document, and we have met, and our partners and people involved have used this document in terms of meeting with provincial, territorial, and federal government to kind of raise awareness. And that was the other thing. Like, we really found that a key thing that we need to do as a community is really elevate the urgency of this disease, and that, we need to address it. It's a growing crisis. We know that it's going to increase, it's expected to increase to 9 million people by 2040. And it's a leading cause of disability and workplace limitations. So we really need, as a collective, to take action and get the attention of governments, and for them to understand the economic impact of it. And, the data that we have around this is a bit dated, but it was over $30 billion that it's costing, from direct and indirect costs to the Canadian economy. And that's probably, it's a higher number likely now. But again, we don't have the data to really understand that. So we've really used this as an impetus to help move forward in terms of, okay, how can we as a community really work together in developing this arthritis action plan?
Right. And I think what I'd like to follow up with, Kelly, is that Arthritis Day on the Hill is also a symbolic start to a larger initiative that the arthritis community is embarking on. And that is a strategy or framework for arthritis in Canada. I mentioned that ACE and Arthritis Society Canada are co-chairs of an arthritis arthritis advocacy and awareness working group that is part of this development of a strategy or framework. Can you tell us a little bit more about that as we move forward?
Yeah, I mean, we could almost do a whole show on this as well at some point. But so the Arthritis Action Plan, this, I think Joanne meant, like, there's 21 right now, arthritis ecosystem champions that are part of this. And really, this goal is to develop a pan-Canadian strategy that's really going to revolutionize health outcomes and quality of life for people living with arthritis. It's a really big goal. We think that it is achievable if we work together and we collaborate together. So Arthritis Society is sort of leading the work as the backbone organization. We're following like the collective impact model. So that's really about shared decision making, listening and learning, involving the community. We are doing a lot of work in terms of, we want to engage, it's really our CEO, Trish Barbado, always says it's going to be the largest co-created plan. We want to engage over 1 million Canadians to have input into this plan. So there's work underway around that. We're doing a lot of work also to try and reach as part of the champions and many organizations, as is, 21 are involved, is trying to work out to some diverse groups and equity seeking groups that may not have felt that their voices have been heard. So we're being very deliberative in this process and trying to really engage many different Canadians, people living in Canada, Indigenous peoples too, to really get their input as we move forward with this plan. We know that there's going to be many different parts to it, and some will move faster than others. And so we have 3 pillars that are part of it. So the awareness, advocacy, empowerment, which is really, Kelly, as you mentioned, there, we have a working group that's sort of working on some of the stuff because that we know that we can do together now. We have another pillar focused on equitable access to arthritis care, and then the other pillar around research and innovation. So work is happening in all those. And kind of the goal right now is to have this plan in the next, by 2025, 2026, and then it'll have some really strong recommendations that and again, it's a collective plan and a co-created plan that we're really trying to make and then start moving forward to implement. And then also, there's some work that we are doing now too, as you mentioned, around the awareness and advocacy working group. The lobby day is one thing, but we're also as a collective working, trying together on some of the provincial elections that are happening in BC, Saskatchewan, and New Brunswick. And we've collaborated, Arthritis Society Canada, ACE, CAPA, and some of the other groups. We've collaborated in terms of kind of having shared messaging and really trying to work together to raise the profile of arthritis and for governments to start taking arthritis and making arthritis a priority.
Fantastic. And I will promise that I will talk to our producer about dedicating a episode about the Arthritis Action Plan, Kelly. So I will follow up on that.
Thank you.
Well, I mean, obviously, this is something we're going to be following because really, we're talking about an endeavor that's going to occur over the next 10 years, in fact.
Yeah, and longer, right? I mean, we know, we have things that we think we can do now because as a community, we do have a lot of, reports that we've done and things, and it's about how can we work unitedly to really push it forward and really try and have some common messaging now. But there's other things that we need to all work together to figure out different solutions.
Absolutely. And a reminder to our viewers that we will have links to the State of Arthritis report card and the Arthritis Action Plan at the end of this episode. So they'll be able to go in there and dive a little deeper and learn more about both of these really, an incredible landmark document in terms of the report card and the initiatives behind the Arthritis Action Plan. I want to just turn back to Arthritis Day on the Hill and ask Joanne some, I guess, questions about sort of the specific asks that our group is going to be making in Ottawa. I think just a reminder to our audience that the federal government, as many of them know, provides money for the provinces and territories to deliver healthcare to their residents. And in the past year, the federal government has signed bilateral agreements that I think Joanne referred to earlier that outline this arrangement and set specific goals and deliverables for the provinces and territories. But it's also important to know that the federal government is also responsible for establishing guidelines or frameworks for chronic disease management, including things like wait times for surgery, including total joint replacement, research funding, health data collection, and the drug review process, and collaborating with the provincial and territorial government drug plans on drug reimbursement coverage. Joanne, I guess what I'm wondering is we have, as a community, have a number of public health policy priorities. What ones will we be focusing on when we talk to federal government representatives today?
I think you already touched on a few, which is, it's great. We're speaking the same language already, and I think we have through this whole process being in lockstep. It's amazing to work together and to make it easy for the government. So, we know the government's responsibilities, as you laid out, is not necessarily the delivery of the healthcare, but it's servicing the provinces and territories so they can service the healthcare to the patients, and really taking a leadership role when it comes to areas of great need. And of course, joint replacements, wait times for joint replacements have been incredibly long. They suffered during the pandemic. They are suffering again. We still have backlogs. We still have long waits. And there is that opportunity through those bilateral agreements to ensure that we have some targets, we have some markings in which we should achieve, try to achieve for provinces and territories to address wait times, and patients won't be waiting as long in pain. So that is a key ask for our day around wait times for joint replacement, reduction, and approaching it from a strategic perspective. Is there an opportunity for the federal government to implement some sort of strategy along with the provinces and territories? This is a really work hand in hand with the provinces and territories to address this major policy need and this major health concern. Also funding arthritis research. It's been a long time for, arthritis has been underfunded, and it's enough. It's enough. We need the funding. We are the most chronic disease in Canada. And we're not receiving the funding that demonstrates that. So we need to do that work. We need to talk to the federal government about what they can do, what needs to be invested compared to other similar diseases. We need to be there, especially Kelly mentioned those numbers. We're going to have 9 million by 2040. That's astronomical. It impacts almost everyone. So it's time. Another policy recommendation is around health data. Big topic, of course, represented throughout our report card. Really that key message being we don't have enough data. To really understand the huge cost and the challenges of arthritis. So we have a pan-Canadian health data strategy. We have recommendations in that strategy. It is time to implement some of those recommendations, and we can be at that table to help do so and ensure that patient voice is there. And finally, of course, equitable, timely access to medications, to arthritis medications and treatments. Different governments or different parties have different approaches. And we know it's a highly political time at the federal government level at the moment. So different parties are going to have a different approach in terms of how they look to assist our medication needs across the country. So we're saying bring the patients to the table. And as patients who are representing arthritis, we know we need many options when it comes to medications. What works for one will not work for another. And it's a lot of trial and error. And if we don't have a very thorough pipeline and a very nimble approval process, this is going to be a problem. So we really want to make sure that faster, better access to treatments and medications is available.
Fantastic. Certainly a message loud and clear, Joanne, from you is that the time is now. And the time is going to be happening very soon in Ottawa on October 8th, when we're going to have teams of arthritis ambassadors running around the corridors of Parliament, talking to decision makers and policymakers about all of these really important points and policy priorities that both you and Kelly have described. So I wish the teams good luck today, who are going to be volunteering their time, advocating for people living with arthritis. The time is now. And thank you very much for your time today, Kelly and Joanne. And we look forward to talking to you as these initiatives advance through the next coming months and years. Thank you very much for joining us.
Thanks. I just maybe add too for people to follow on social too during our lobby day, because we'll be doing some posts, and if you can help amplify that we're there and the messages through your own channels, that would be great. Thank you.
Great message. There'll be links again at the end of this episode for people to be able to follow up and to share. And I want to thank our viewers. Thank you for joining us today. A really important day in Ottawa for arthritis. Again, representing the people living with arthritis across Canada, unifying and amplifying that patient voice. So thank you, viewers, and we look forward to seeing you again in another episode of Arthritis at Home.